ladies and gentlemen, it is Friday, and when available, which is most of the time, we are joined at this time, first hour of the show, halfway mark of the hour, by our friend Dr. David Samadi, Vice Chair of the Department of Urology and Chief of Robotics and Minimally Invasive Surgery at the Mount Sinai School of Medicine. Every time I say minimally, it's always like a crapshoot. I never know if it's going to come out right or I'm going to, but it's 9 out of 10 times I get it out. I don't know why. How are you, sir?
Good to see you.
Good to talk to you. Good to talk to you.
It's always fun to be your show. I can't tell you how many people, since we started working together, they absolutely tune in and they get a lot of great information, and it's a big hit. So continue the effort. It's a wonderful show.
Well, great. Thank you. The information comes from you. I'm the stooge. I'm the straight guy. But let me ask you this. Okay, let's talk about something which I haven't, it's a term I'm not that familiar with. Certainly the term menopause. We know of and we think of it, in terms of women going through menopause, but male menopause, and I got a feeling it has something to do with among other things, levels of testosterone shrinking and declining, right?
Yeah, it's absolutely right. So male menopause or andropause is a real term, and as you mentioned, when you hear menopause, it's mostly in women, and it's also very much abrupt. Women know exactly when the hormonal changes are happening within weeks or days. In men, it's a very gradual process. And when you start in your 30s, you have the peak of testosterone. And over the years, the testosterone starts to go level down. By the time you get to your 50s and 60s, the level of testosterone could be low. And that's when people start to get very fatigued. The sex drive is going to be down. You're going to be depressed a little bit. Couch potato, you don't want to do anything, and that's what we want people to know, that that's a real entity called male menopause, and your testosterone is probably going down, and you need to check with a blood test to find out what the level is.
Okay, so you're looking for a testosterone level. I know there are all different kinds of testosterone tests, but let's say I think the condition is commonly referred to as low T.
Yes, that's right.
I learned that from the commercials. Okay, so someone has low T. There's all kinds of, at least I've heard, controversial opinions on, whether or not you should take testosterone, or if you take too much. And you hear all these crazy warnings, like you do with all medications on TV. Keep it away from pregnant women, keep it away from kids. If hair starts growing, it's like you picture it as being this thing that might be valuable to the person, but it's very mysterious and dangerous and can cause all kinds of problems for those around you. So what's the best way to address this if you're a patient and you're found to have it?
Well, I think that's a great question, because also the number of ads that comes with testosterone, and we all have seen the older gentleman who is really beefed up and he's muscular that takes testosterone. You got to be careful about some of these commercials, because if you, for example, have an enlarged prostate, or if you have history of prostate cancer, you don't want to just start taking this testosterone. It's really like oil in fire, and you can really cause a lot of damage. Having said that, I think if your testosterone is low, you got to try to talk to someone and see if you can supplement that, because that would prevent osteoporosis. It takes care of your body mass and your muscle mass, etc. There are a lot of options. There are injections. There are almost now the new thing is the deodorant that you can take and use, and that would increase. There are gels that you can use in order to increase the testosterone. But the big message to a lot of people that see these ads is like, I'm tired and I'm fatigued, and I'm going to start taking this testosterone. That's a wrong answer. Number one, if you get your testosterone and the level is low, you want to make sure that you repeat it again, because it could be a lab error. The other thing is that the testosterone level can change during the day. The highest level is around 5 o'clock. There's no medical office that's open at 5 a.m. So try to get your test around 8 a.m. or 9 a.m., not in the afternoon when the testosterone level can go down. That's another thing. And finally, look at your whole entire health and talk to your medical doctor before you take these, and find out what the risk and benefit is. For the most part, if you're obese, you need to lose the weight before you get this, because the fat around the stomach can absorb a lot of these hormones. So when it's indicated, it's a good treatment. It can slow down the osteoporosis. Certainly, it can increase your sex drive. That's one of the things that people suffer from. when it's indicated it's a good medication, but be careful about some of the commercials out there.
Yeah, no, like anything else. We're talking to Dr. David Samadi, Vice Chair of the Department of Urology and Chief of Robotics and Minimally Invasive Surgery at Mount Sinai School of Medicine here on the Steve Malzberg Show. So the symptoms are, and the symptoms that you describe, fatigue and lack of interest, or wanting to be a couch potato and lack of sex drive. The problem with going out and self-medicating based on those symptoms is, I'm sure you would agree, that could be attributed to any number of ailments.
100%, and I'm glad you brought this up, because a lot of times you may have some underlying prostate cancer that you're not aware of, and by putting testosterone in it, all of a sudden you have a wildfire and you can have cancer spread. So before you go on any of these medications, make sure you see a urologist, make sure you check your PSA and find out that your prostate is healthy before you do that. And those symptoms that you mentioned are real, meaning that they are fatigued, they don't want to move, they're gaining weight, they're depressed. And, getting your red Ferrari is not the answer. You want to make sure that you check your testosterone. And it's the real midlife crisis is there, but there are a lot of treatments. You got to make sure when to pull the plug and get the treatment and when to stop.
Now, you mentioned, get the PSA test, and there's been so much debate about this, and you and I have talked about all this, and, and the same for on the women's side with mammograms and the new recommendations, the new guidelines. Do you believe that all these recommendations and guidelines that are saying, don't get a PSA test, get the mammogram when you're 50, not 40, and get it every 2 years and not every year, do you believe that that's all, related to the coming Obamacare as a cost-cutting measure, or do you believe that this is what the science is showing should be done?
Okay, so I think like a lot of it has to do with the tsunami that's coming toward us, and nobody knows. And we see some of these guidelines, and the U.S. task force every week comes up with some unbelievable recommendations. I'm not going to get into the politics of it. I think that's part of it. I think financial aspect of it is a huge part of this. As a physician, as a doctor who deals with prostate cancer and PSA, to come up and say that your first PSA should be the age of 55, I think it's an absolute mistake. It's a crime. I see so many patients even today in their early 40s with horrendous cancer. And this cancer is going to spread. Now, what they're saying is that there are some prostate cancers that are slow growing, and you may not need a treatment if you have other medical issues. How do we find out that they have those kind of cancers? It's only PSA. And until we get other modalities, the day that Obamacare or government agencies are going to say, well, don't do mammogram, but we have these other options, or don't get your PSA, by the way, we have other options and other screening tests. Until that day comes, the big advice to people is get your PSA, find out what that information is. What you do with it is to sit with your expert doctor to say whether you need a biopsy or not, what is the trend, what is the velocity of that PSA, how fast it's going up, and what to do. But to put your head in the sand and say no screening, that's going to get us back to 20 years ago when we would see a lot of people with metastases, spread of the disease, horrendous symptoms. We don't need to do that. Yeah. So I hope people listening to this and follow this recommendation.
Yeah.
Be wise about it.
I mean, if we have the ability to weed it out and to detect it early, then to me it is a crime that people would be advised not to do it.
And you know something, Steve, we've come a long way. And while surgery is not for everybody, people don't have to be in diapers. They don't have to suffer from sexual dysfunction. I do this week alone, we had about 18 to 20 cases, and there are a lot of experts out there who do an amazing job. You need to be in the hands of someone that does this day in and day out. If it's breast cancer, same thing. The number of cases, the expertise determines your outcome. Don't be scared, but just make sure you know about that information and you're doing the right thing.
All right. Doc, it's always a pleasure, sir. Till next week, have a great Memorial Day weekend.
You too, my friend. Enjoy your weekend.
Thank you very much. Dr. David Samadi, ladies and gentlemen. Always chock full of great information. And, this low T thing, you can get caught up. It scares the heck out of you, right? When you're watching TV and you see these commercials come on, and then they tell you, even the one with Phil Mickelson or for the rheumatoid arthritis. And, hey, I can't open a jar. I can't do this. So I took this pill. But the pill could lead to, TB, fatal infections, this, that. I mean, it's crazy stuff. I mean, if you listen to the whole commercial, why would you ever take that pill? I don't care what you got. I mean, you know, you live with the arthritis as opposed to risking what these pills, even though, you know, might be a slight risk. Nonetheless, they have to say these things, obviously, or they wouldn't. They have to be honest about side effects and warnings in the commercial, which I think is a good thing.